Hi everyone. Today is an unexpected but scheduled talk with Ivan from Knopka. Uh, he will tell basically his story, how we talked like before, 5 minutes before the stream, how Ivan is saving lives already and saving hospitals from not being good enough. So that's great conversation, especially after when I've asked after like several streams who I need to talk next. Knopka even was the next, like recommended by almost everybody whom I asked, who into startups, into accelerators, into VCs. So this was expected, but not scheduled great enough a week before that we will collect audience. So we hope a lot of people will listen to this after, not like right now. But I will publish and we will, as always, it will be available as a podcast. And, as always, there is a QR code for everybody who is listening to us because we need to donate to Kola to help our army. That's important for us, for everybody who is listening to. So, Ivan, hi. Officially.
Hi, everyone. My name is Ivan from Knopka. Thank you, Sergey, for inviting me here and sharing some of my experience. And thank you for the Ukrainian army that we have a chance to be here alive. And I want to add some small part to your presentation of me that I'm not saving life. I assist.
Yeah, you're not. Yeah,
and doctors are saving lives. Yeah, let's just put it clear. Yeah,
that's we'll talk about it. You are saying that you're not saving the lives because you have a medical degree, basically. You know what the difference is between promoting this and not. Okay, let's start from beginning. We'll get into your education and how you became startup founder eventually. But first, what is a Knopka and what do you do to help people?
Knopka in Ukrainian language is a button, and long story short, when we came with idea to the customer without any product, we tried to explain that we will have some application for nurses and it will notify with something, and then we will manage the operations in hospital and blah blah blah. And it was extremely unclear what we were addressing to our customer, but some of that 70 people we met in the very first 3 months, some of them called us when they met us second and third time. They said, "Oh, that's some guys from that button. I don't know what is it, but okay, let's talk with them again because they are strange little bits." Then I understood that okay, I haven't had any idea what the naming should be for a system which assists the nurses and which, in a vision of our team, should be the personal assistant for the nurse, because we cannot afford the nurses, in fact, because the salaries and there a lot of nurses should be, and to help them in operations. I don't know, nurse helper, I don't know, maybe something else. But then I realized that if my customer, the hospital director, the guy who take decision, easily recall me as a button, Knopka in English, in Ukrainian. So just let it be Knopka. It's easy to remember. And when they will take this decision and approve a contract and try to find my contact in there, that Ivans, they have a lot of them. Ivans with second name. It's better to have this Ivan Knopka, and the contract will be here. So what is Knopka is, I try to give the speech that this is a nurse's personal assistant in daily operations, focused on care to the patients. They need to deliver. It started, I believe, in the different combinations of previous experience in my education and my work experience. But the idea came to me and my grandma together when I was with her in a hospital, and the second hospital and another. There was a very complicated, very easy disease, but complicated because it was too late. It was not a cancer or oncology. It was really a simple thing, but when you do not fix simple things with your health in the beginning, it becomes huge and like this big ball of snow, which blowing you out. So we spent around 8 or 9 or even 10 months in different hospitals, and we had in few of them that standard nurse call button, and we pressed it, and nothing happened. We heard that something on the nurse desk is happening and alarming and blah blah blah, but the result was not expected. Expected result when you press the button to call the nurse is 3 minutes, and she's here because you have some blood sinking or some pain symptoms or something, or panic or anxiety. But the story is that these nurses buttons, unfortunately, more relevant for restaurants, where you have 6 tables and you have capacity to visit these tables, and you have tips. And nurses do not have any tips. They have 50 tables, 50 beds with patients, and it's a little bit not relevant. The system we had in the hospital was not relevant. There are nice ones in nice hospitals, but not much nice hospitals we have in global healthcare. We have this small percent of nice private or nice public, but mostly, unfortunately, systems are like waiters because they're affordable, cheap, and it will help the hospital to meet regulations to have this connection, but it doesn't solve the problem. And the idea was with me and grandma, hey, maybe it's better to reach nurse in the Viber because they usually chat with their families in Viber and in telephone. And we thought, okay, this is nice idea to maybe. And then we forgot about this. And, because I had a job and I had some kind of life perspective for what I'm doing, blah, blah, blah. But the intention and connection with the nurses in these hospitals became something more personal. And we tried to send them some compliments, like sweets or new beds or new chair for nurse desk, comfortable one, like I have in right now. And once I called to the nurse and asked, hey, what do you need more? You need something else? And she said, send yourself, because when you was here at the hospital during your grandma was here, it was much easier to work. You were forwarding us and reminded, because I was a nurse when I was studying in school, and then I had medical education in medical psychology. My field was oncopsychology, so with oncology patients. So more or less, I know what is the operation flow for the nurse, and I was bored because you sitting in a hospital is boring. So I found myself having nice time with nurses to, hey, go there. This is the new prescription for the doctor. Go do this.
Managing stuff.
Yeah, and then I understood. Okay, I cannot duplicate myself. I cannot send if I was relevant for them and for other ones in different departments. My grandma was. Maybe it's better to send them something which will help in operations. It was not idea to create startup 100%. And I started to look for the nurse call button, but I wanted to find something what we was talking with my grandma, with telephone, with time control, and my head was I don't know, mind blown, because I spent a week or two chasing these systems. I found two things that unfortunately it's a capital investment. But even with the capital investment, we were like, okay, let's buy something, maybe not so much relevant, but something. And we fundraised a little bit money, me and 3 more friends, to buy a little bit better than waiter system, call nurse call for that exactly hospital department. And I came to the hospital director, hospital manager of that department and said, hey, we have fundraised money. We have this system. Let's implement it in your facility. And he said, no. He said, no, because we do not want any engineering. We do not want this mind-blowing story with certification of wires and electricity. This hospital electricity is very sensitive thing for attorneys. If something going wrong within a hospital or hospital will burn, they will check if all the connections were right, if everything was certified, and because I didn't like the solution we fundraised for, I was like, I don't like it at all, because it was required these repeaters in every 10 meters or something, and we had 80 meters corridor. It's really very huge corridor for 23 wards, so it's really big, 73 beds it was. And I was like, okay, I'm not a technical guy, but something on the intuitive level says that we already live in the world where technology is enough to cover this with Wi-Fi. I was wrong. I was wrong all along, but this
Wi-Fi should be certified in hospitals too, I think, yeah? It's radio connection, because Wi-Fi should be certified in hospitals too.
No.
Because it's a radio connection.
All along, because it's not a very scalable solution. It works solution, and our first prototype in 6 months in surgery department was on the Wi-Fi based, and it worked. And in fact, it's working right now still. But to scale after, I understood that Wi-Fi is not the technology. It's not safe technology. It's not something you expect from such system to call the nurse. And this is how it happened. So I tried to cover this in a more or less understandable way, how the idea came. So it was like this.
So basically you came from your own experience with your grandma in hospital, and you understood that the simplest system to call for a nurse from her desk to a room is the worst experience ever. Because I don't know, from my non-medical at all point of view, 3 minutes in a hospital, it's you're in a hospital because you need attention, and 3 minutes, it's like 180 seconds. It's too much. In any case, I think I have seen
our average nurse delivery is around 2 minutes 40 seconds.
Okay,
we're close.
Yeah, close. Because I have seen in your interviews for, I don't know, Liganet or something like that, you said that in test runs, doctor arrived in 1 minute 24 seconds.
Different departments, have different time delivery, because some of the corridors are 80 meters, some of them are 15 meters, and it's more realistic to do this in 1 minute. We have a department where average is 50 seconds, so it works. But average around the whole different, more than 30 hospital departments are like this.
Yeah. It's okay. And Knopka right now is a mobile app, basically, or it's like what? What works right now, today? You visited hospital, and what you propose?
What is Knopka? It's a cloud-based system. We started with a device, and we did the local solution for every hospital department with a local server, with a very strict and simple logic, heuristic, the straight one. And it took us a year to develop this auto-checking system, which reflects and health check itself, and it works. And the last issue we have is this Wi-Fi problem. So it's also the part of the why it should not be on the Wi-Fi, because it's not scalable. So you need to push some part of support of a real engineer to support this, but more or less it's working. Then we decided to do this cloud migration. So of this solution to develop cloud and helping our market institution in Ukraine, like Ukrainian Startup Fund, acceleration companies, incubations, and different supporting programs like USAID and others. We were provided with programs from AWS, Amazon Web Services, so for credits. It helped us to develop cloud infrastructure. And I believe that, of course, we will pay some money for Amazon and AWS, this cloud services, but what we have delivered and delivering to our customers is I evaluate more than we will pay for them for their services, and I really appreciate their impact and their investment in us, because it is an investment.
Yeah.
And we started to connect cloud-based solution. We had some buttons we developed ourselves. It's a part of hardware, IoT, it's scalable, it's very nice. But while developing this big cloud solution, we understood that we can start easily with hospital to start our intentions, because hardware, even if it's wireless and cloud-based and do not require any training and do not require any engineering, and it's stable and wonderful, is still hardware. You need to agree with hospital to be installed in their facility. And even me, who loves this product so much, who, as you asked, CEO of Y Combinator, saying the things that don't scale. I believe in product, and when I hear no, I do not take this no. I go to my homework, recap my presentation, and it will be yes. But it's still a lot of time. The customer acquisition time was like 1 month, 2 months with one hospital. It's a lot. You cannot change the world or something to something good if it's your customer acquisition is so long, so it's not so much scalable. But I believe that it will happen, and because of our wonderful team, we developed this part of how to reduce this customer acquisition, and this cloud solution can be forwarded to another process of care delivery in a hospital. And one genius hospital director, he said, "Wow, this Knopka you have is very nice. In fact, I have one. It's very nice, and we want this for our infection department with the kids and blah blah blah. Can you also put this product to emergency room, and we will call physicians and control that they will be here in, I don't know, 5 minutes, 10 minutes, any minutes, because we have all usual fight with attorneys of the families of the kids, and they want us to prove that our doctor was at emergency room fast."
So you are measuring system right now.
we always was this measuring system. We was attorney of the nurse, and we still are, and we're now also attorney of a doctor, because in our solution we have this. Oh, you do not see anything. Okay, you see
unfortunately, no.
Okay.
I will put your demo. I think you have one on your website. Yeah.
No, I do not.
Okay. I have seen it in media.
Okay. So it's there is only one button for our users, and it's archive and statistics. So they put it, and they can always show every day, every single call, and they can prove, okay, I was not there in 3 minutes, but I was in 4. So stop trying to fire me or make my life more awful than it is.
So basically, every patient in a hospital have some Bluetooth low energy beacon or something like that. No.
This solution is I tried to explain is for nurses to call their colleagues, doctors.
So nurses calling okay.
Yeah, for emergency room. When someone in a car crash driving by an emergency car, emergency room. And so the problem is that this neurologist and neurosurgeonist and ICU team, they're slow, and you never can prove that they were there very fast and control this and automate this delivery. And they use pagers or telephones, and this is not a delivery control pagers. I don't know what is the audience now. But
Actually, audience clinics, I have like listened that pager is still relevant in the United States clinics and hospitals because of what you're telling. Yeah,
okay,
they like one way request. You need to go, and their network like is the same like you said. Like every 10 meters, some repeater should be there, and they like building this. United States clinics and hospitals can do that because they can spend millions on some irrelevant technology to be relevant.
I do not
Not
want
us.
to address this to United States hospitals. I was in them, and they have nice
Yeah,
systems, and there are
yeah,
nice
yeah,
systems. But when we talk about patient pagers, it works in a way when you have this structure and team training, and you spend a lot of resources to keep your team of doctors and nurses motivated and related to the hospital they work in. And if you die as a manager or something happened in your life perspective, this hospital as a unit, as an institution, need to do it again with another team and another people. And it's a risk because it's a human factor a little bit. And in this point of view, from this point of view, the pagers can be a little bit outdated technology because it notifies where you should go, but it does not provide a control that you was there. Our solution notifies, and the call is closed when the doctor is around 10 meters of emergency room and his hands are free. He do not need to do anything. He just go into the patient. We track, okay, you was here. You wasn't here, we will call again. You wasn't here in set at time delivery, time which was set for this delivery. We will call your manager, and the hospital director need to be woke up because something happened bad in his facility. We need to fix this, something like this. And this flow with very simple installation, we connect the whole hospital in one day, even less, with every single hospital department. And we do it without any training because there's no training needed to understand that. Okay, I have.
you have a mobile phone, yeah.
And we do not train nurses, so somehow it jumped in the hearts of our customers, and we started to close deals in Ukraine very fast. If we count in growing. So we connected 16 hospitals before July 2023 this year, but it's more than 20 plus hospitals in this recent 2+ months. So we grew more than 100%, and it's and you know, the television, national television, never come to us before. Somehow it happened. So we are very excited and a little bit shocked that wow. They appreciate what we did, and it works. But more important, that it's really something that nurses likes.
Yeah,
nurses likes our button after we install it. The next day they like it. When we install this nurse button, which will notify them before the installation, the customers were like, "Oh wow, it will be controlled. No, I don't want to do this. I will not use this phone or something." But when it works, it's okay. With this part of Knopka, the nurses who was not on the shift but saw the stories of their colleagues commented that, "Oh my gosh, I cannot wait to for my shift because I hated these calls for that physicians. I don't want to speak with that doctors. I just want to put that button and have the power to drive him here in this 5 minutes." So this is important for us, and this is something we work for as a team. We really are motivated so much. Of course, we have some issues with this growing story that your processes need to be improved and operation skills should be scaled, and nobody is super one professional. We have this level of self-criticism, but it's something that, okay, we need to do this because if we really want to scale to hospitals, to more hospitals, to more customers, need to develop this. to not be out of capacity to do this.
Yeah. That's like you're saying that you have basically product market fit. So my next question will be about: have you ever experienced that client called you to sell your product to them?
I have experience when my client drive to another hospital with me as a kitten in a box. And like,
Yeah.
hey, this is Ivan. He made this for our hospital. The whole hospital is connected. Please try him. Feed him with money. Yeah.
That's a referral.
Yeah, referral. But it costs nothing for our company. It's like have a nice time. We had these calls from hospital directors or their managers before we had this completely software solution before, and it was nice, but it was not some kind of we can expect that this month we need a guy on the telephone. Unfortunately, no. In healthcare, unfortunately, it's a very complicated market, and the work of sales guys, I don't know, they need to be really appreciated, because to sell something to this industry is very complicated, and they call, I'd say every single dollar you pay to your sales guys, you need to pay $2. And but now we understand that some kind this thing can become more viral, and now we have this request more often. Today we had 2, yesterday we had 1, the day before yesterday we had none of them. I don't know, but it become more often. So it's something we can cover in marketing, and then build the structure inside ourselves to answer the calls. Because I don't want, and none of our team wants to lobby some of our products through ministers of health or some kind of wonderful government organizations. If someone thinks that it works for healthcare, it does not. It makes our customers not responsible for their facility they need to be responsible for. But to make your product wanted by customers itself, it's something which opens competition for other companies who do something close to you. It opens market for you, real one. You really can count the request. Request will be not because it's a regulation. Request will be because your product is nice or fit for this exact customer. So this is something we think in a frame of the whole upgrade of our team, and we need to do this hard thing of operational management of our tasks and processes. And one of them will be this managers, maybe 2, 3 of them, who will work with these requests through different channels. Not sure that it will be telephone. We will try to cover it in a more accountable way through the web pages, social media, and others, where a customer is more easy to address his requests, to have our system in their care facility. It can be not hospital only, it can be airport, because airport is a huge facility, and to force ICU team with defibrillator to some person in these lines when you wait security check, it's really not nice. Of course, you can have defibrillator in front of every single wall, every 15-20 meters, but do you know how to use defibrillator in a stress situation? You will read this manual? No. You will be shocked, in panic, and you can harm the person. It's better to push something very easily, notify that ICU team where they should be. They will be here in 3 minutes. And this is so-called blue code for ICU delivery. So this is something we will work in.
That will be less phone, more some device based.
It will be something.
Okay.
Maybe I didn't get your question. Can you please repeat it?
Yeah, it's about that in airports, in any like manufacturing, everywhere like where medical team should be. You could be there, like, because you are the button for them.
Yeah, I mean that the stack of technology is the same as with the hospital. So the ICU team have their different phones. Someone push something in a critical wall, this spot of blue code. They touch this, and the system notifies them, and the nurse call button tracks if this beacon devices or phones of the ICU team are closer than 5 meters, and then we will close the call. So care delivery could be not only in a hospital, it can be in your home, it can be in care facility, assisted living community, it can be in rehabilitation center.
Everywhere where, it could be.
Because they're not hospitals, it's a capital investment to provide such solutions. So that's why they have this waiter call button for restaurants, you know.
Yeah. Wow, that's a huge opportunity. And you're already, like, as you said, popular between hospital directors in Ukraine. And as I have seen your own newsfeed, you're traveling a lot between cities, sometimes between conferences like Accelerator. So you're busy right now a lot. And what about, you said that you had you launched in Poland, and so you operate there right now, or you like switched to another solution? I don't know.
You know, the story when we started to call ourselves startup came to our heads once when we understood that, okay, we want to do this for hospitals, this, but we do not know how to scale. And someone very smart, he said, my friend, other startupper, but I didn't know that he's a startupper. He said, you want to scale this wonderful solution for the nurses and patients. There is a method, the type of scaling, and it's called startups. There was one. What? This is something which is blowing with the idea, with I don't know, something like Tyrannus or something. So everybody is scared to call anything startup. So you think, oh my gosh, no, I'm doing real business. I'm selling something to hospitals. And in Ukraine, you know, we do not have this investment industry for early stage companies. So nobody give you money for idea. Nobody give you money even if you have some kind of MVP. Maybe somebody will give you money in not a very ecological way, and it will make the startup not investable in future and others. So I believe the bigger part of startups from Ukraine are bulletproof, because if you do not have money from your customer, you're dead already. And it's true, you know.
I know.
Risks with war here, and we can be killed because of a Russian rocket. But if we count the chances of being in a car crash in the United States, I'm not sure that the chances are very, very distant. But comparing the bulletproof business model, Ukrainian startups, I believe, very nice. So we started to do this as a startup. We started to do right things. We started to learn, incubate, accelerate, and others. And the key message was, for me, an advice like this: if you want to scale this in Ukraine, in your country where you live, where you love your hospitals and your nurses and doctors, and you perceive yourself as a family of these people, you need to be scaled on other markets. You need to be a global company which will be put on the table of a hospital director. So they will have Philips, they will have Caretronic, wonderful company from European Union, and maybe yours company if you will be somewhere there. And you know, it's a kind of painful advice. And I know some of the advisors to American startups, they started to force American startups, especially in healthcare, offer to start to grow in other markets, because passing these FDA regulations are extremely complicated. I had a chance because of our wonderful Ukrainian startup fund. This January, I was in San Francisco. I was at JP Morgan Healthcare in some different side events, because the whole conference I was not attended, but there was a nice time around. And I was at the pitching, and I saw that startups who operate 2 or 3 years already, shows in their pitch deck that they will be on the market in 2028, and I'm like, what?
Yeah, yeah, yeah.
In 5 years? And I understand it's not because this startups is bad or this innovation is something fraud or something. No, it can be brilliant, but the regulation is so complicated. So to sell oxycodone is more easily to big pharma company, as we know from Netflix movie. But to deliver nice innovation, which are so brilliant in American startups, I met some founders, and I'm so inspired. The regulation market is complicated. In Ukraine, we have other problem. The market is small, and that's why we were forced in 2020 to start to speak with other markets. And I had, as with you, I just wrote in LinkedIn to a few CEO of medical distribution company in Poland, and one of them, nice company, replied. And it was like a COVID, and everybody was shocked, but we started to have a nice conversation and have a nice time. And in 5 months, I was sitting in their apartment, in their office, showing our product, and we sold solution for 200 beds. So this is how we started to operate in Poland. But of course, we have the same story with certification, but much easier than in the United States, much easier. And then making startup, you need to do business development. So that's why I'm attending big healthcare conferences, tech conferences, some meetups. I'm not doing this all the time. I'm more focused with customers, but we are trying to do these right things. In Poland, we established company as a European Union company. We connected with different market players who are distributors, and from the April of this year we started to present, having the certification, we started to present our solution to the customers, to the distributors, to sell this as a hardware product, as a button for the bed. But now, having this software emergency room, we making this, I don't want to call it pivot, because it is not. Because every single emergency room comes with hardware button in a sales point, so it's like upsell at once. So they understand that, wow, this is working and it's nice and it works, and all the hospital understand how it works. We need the same to our beds. But when you start with the beds, it doesn't work. So this is why we are moving like this. And we expect in next half of the month, at least 3-4 hospitals in Poland. We are now under acceleration program by European Council in Portugal. We work with contacts we gained here.
Yeah, I can hear you, yeah.
We work with our contacts we had after our business development from the conferences in Netherlands and in Finland. And these markets, we will try to establish our pilots, start first emergency rooms. And before this will happen, we need to upgrade and update our operations. So this is what we are working on to cover this scaling. Of course, we expect for competition. We understand that solution seems to be very easy. It is not a coincidence that it's easy. It's easy because we love it so much and we work on it so much to make it easy for the customer, for the user to just embrace this. And I understand that from the street, watching in the window of this something. It's very easy. Working, yeah, and maybe someone will try to copy or something like this, but I understand that the team is not, how to say, copy ready. It's hard to copy the passion of the CEO, of me, of our CTO, our chief operation officer, and every single person who's working in the team. And this is something which sell the product. This is something which help it sell. So, of course, we are not about to be slow. The time is everything. Every day we're losing money. Every day we are like, but I really hope that our future story of its success will inspire some competitors to improve healthcare processes in their countries or something on markets. In our market, I expect that maybe our story will inspire some other startups with other ideas, and they will say, okay, these guys are opening hospital directors' doors with a leg, so maybe we can also try. And maybe our story will bring this idea that the work of hospital manager and hospital director is to sit in their cabinets and wait for your solutions to upgrade their operations.
Yeah.
Something like this.
Yeah, I when I started to read a lot about how you operate, that's why this was questioned. I think you started with more complicated solution than it is right now, because you will never create solution with two phones basically that are connected with beacons from the start, because it's too simple. You need to know about this market so much and be well connected, well educated to create a simple solution. Simple solution is the hardest one, not the easiest one. And you are protected from being copied, just because corporations can't copy that, because they need their own, I don't know, Philips can make their own phones, but I don't know what other companies will do. All other corporations, you are simple because you can buy phone, deliver it, and that's it, and they're paying subscription for a device, I think, yeah, monthly,
I
something like
believe
that.
the copy protection is about that the architecture of the cloud is complicated. A lot of logics are inside. A lot of thousands of these
Lines of
code
code, yeah.
lines are like deep inside, and they
Yeah.
count all the conversation with nurses about their operation. You know, we mentioned once we measured how many kilometers nurses are in this corridor.
Yeah.
For us, it's an important KPI. You know, if you do not reduce these kilometers, game over. You did something wrong, and counting these metrics, you will change the time limit. You will change the intensity of the ring, which will call for the nurse. You will change the color, which is blowing from your lamps. We also have this wireless lamp.
Yeah.
Because, and this is an advice for my competitors, please do not use red light. It doesn't work. They do not react on it. do not use green light or other white light. It appears in real life. We use pink light because it's something you never see.
You never seen hospital.
Okay, maybe on some parties with neon, you know, something. But the task is to take attention, to move this operation and reduce them. So I understand that a lot of such stories are inside, and it's hard to copy this. And in the end, the solution is easy, of course, nice, but this button to work, a lot of background on the background.
That's a good example of technology that to change something to better, you don't need like to have to hire university or some institute to change basically how you said, not changing lives and saving, but helping saving the lives of people.
You need to assist. Doctors and nurses are well educated. What we need to do as a digital transformation of this industry is to research their behavior, research how they work, and optimize this. Do not put anything inside their heads. Take it from their mind. Release them from that stupid paperwork. I don't know.
Oh yeah.
As well, we counted for our inner product research, so how much time nurses spend average for paperwork to count these prescriptions which was done, and it can be up to 5 hours a day.
Oh,
something. This process could be reduced with some solutions, different ones, not only us, and their hands will be free to work with the patient, not to do this paperwork. And this is what I try to address to our colleagues and partners in digital healthcare, that we do not need to replace old paper work in a computer and just copy paste this interface and do the same forms for them. We need to research and work hard to reduce these operations. We need to find better ways to optimize their flow. If all of us will force our attention of IT industry to these operations, there will be chance that when we will be in hospitals, there will be a little bit more high, that we will get our care in time, quality one, and others.
The next question
is not nice.
I can. I hear you well. Audio is good, so that's the most important part. And there is a good article was published or tweet, something like that, from Michael Seibel, again, ex-CEO of Y Combinator. He said that companies, when they're trying to go to market, they thinking that you go to this market and then with this same product go to another market. Like, I know you will go with Knopka to hospitals, and you go to clinics, to all factories that have medical suppliers, and then you'll go to I don't know, restaurants. But what in this tweet he said, but mostly because you started to have your own conversation with hospitals, in your case, with your clients, you know their problems well. So what my question is, what you found the next problem that all the hospitals have right now, but you're not solving it right now because you focused on your current product, but they have another problem that you eventually could solve or will solve, or you will like wait for another company to solve it, but because you have this relationship with them, you're in the better place to solve it, and you like delivered phones to them, so you can do this right from your phone. What will be this such example of next problem?
What I want to address to your audience and maybe to our audience is that, of course, we have this. We have opened some doors and proved to our customers that our product is nice and it works, and they can trust us. And because of that, some other companies we can refer to our customers to test their products, to have this sandbox of technology improvement and others. And I do not need to build next startup because our own is still growing and still starting to grow, and the problem we venture to solve is so huge that I'm not sure that all my life will be enough. Of course, it will be enough if everything will go like this, and we will be not killed by Russian rocket. But I do not have ambition to find another process in healthcare and do something again. No. But what I see as a main direction, which I see not only in Ukraine as a field of problem, is education for newcomers in the industry. Mm-hmm. Do you hear me well?
Yeah,
because
I can. Yeah,
I see that everything is like in a slow motion, and I do not see you.
Your picture is frozen, but I can hear you well.
Okay. Yeah. What I see in different countries, speaking with our colleagues from other markets, the education for newcomers in industry, new nurses, new doctors, a lot of resources are spent for that trainings. A lot of resources are spent for IT trainings for these people. And I mentioned before that they have no capacity to learn something new, and it's very hard for them because the capacity is out because of medicine is so huge, and you need to be so simple to put something as a flow for usage. And because of these newcomers are less and less every year, and it's a real sad future we can find ourselves in. Future without nurses. In Poland, I heard this frightened statistics that more than half of the nurses will be retired in 5 or 10 years, and just 20% will be covered from the newcomers to this profession. And this is a challenge for healthcare systems.
Yeah.
Maybe I'm not right. Maybe it's about the real passion of this institution in the United States, but I'm following different hospitals in LinkedIn, and I like their social media. But what I see is nurse of the month or something like this. And for me, with all respect for the nurses, I see in this the idea that we need to motivate our nurses to be nurse of the month. So we need to give something as an institution back to our personnel to build this loyalty level of attached to our institution. And it's opened this problem, maybe a little bit proof the hypothesis of this problem, that there is no line to this institution of nurses who want to work in their institution, even in the United States. And even in the United States, the work of the nurse is a hard job and a hard thing. And except you need to love people and be professional, it's also not a well-paid job. This was the key insight I brought from the United States. Unfortunately, I had good inspirational insights that wonderful tech startups are born in the United States, and they're wonderful. But bad was that regulations are, maybe I do not see the opportunities. Maybe there are some kind of sandboxes and others ecosystems. I'm not familiar with them. I'm talking only from my perspective of my experience. But what I see, because I see and follow these nursing associations and hospitals and others, I see that this job is not well paid. And God bless. I hope the level of love won't ruin, because if they will stop love to work with people, we do not have enough money to pay them enough to stay at this work and be a nurse. And if this problem is actual there, we have a real problem here, because our country is paying nurses not much. Every single month more. So I see this, that we are growing in salaries for nurses, but here I mean European Union as well. So you hear me well?
Yeah.
Yeah, I do not see you for a lot of time.
So nurses are not well paid anywhere, basically, in Europe, in Ukraine, United States, and that's a huge problem for future.
Because of this problem, the education and fast-track education and digital innovation in how they take the processes on their mind, I believe this is the field and the products our startups all over the world can produce and address to customer. And hospital directors and general nurse will pay for these solutions, because it will help them to onboard nurses, to onboard people in this industry, to help them with this onboarding in a very complicated operation institution with patients and IT systems and pharmaceutical and other medical devices, and all of this is a part of education. And if this some solution will release this problem, I believe a huge potential on the market will be opened. I answered your question.
Yeah, sure. And like I'm going for the last question, and the last one is, that's always when you're talking with healthcare startups, that's about helping people save lives of other people. But what's right now the story you're proud of? Your story that like your product helped people. Basically, you're helping people any day, every day, all the day. But the one that you're proud of.
Thank you for this question. I'm not sure that answering on it, I will say something new, but what I'm really proud that in these 4 years we are working on our product and in our startup, I believe we were able to change the process of care delivery in a hospital. And this is value for me and for team. And this is something we are proud of, because we can be proud of different things. We can be proud that we survived in a COVID. We can be proud that we survived in full-scale invasion from Russia and war and rockets, and we still do operations and other stuff. But this is something we are good guys in. But to be proud, I'm not sure that this is something as a nice story we can tell about COVID, about some kind of issues, about some operations. But I'm myself proud that we really did this. We changed the way how physicians come to emergency room, and this means that we changed it already for other care operations between departments. So physician will go to each other departments very easily. Yeah. That nurse will come to patients quickly. That intensive care unit will jump to the spot of with the code blue call in 2-3 minutes. And this is something we're really proud of.
Wow. Yeah. Huge thank you for joining me today. It's like great story already, how you are changing the industry. The healthcare industry is like the most conservative ones as far as I can see. It's more conservative than like insurance or banking or other industries or markets we are thinking about as a conservative.
But it's an inspiring industry, and it's a wonderful industry, and wonderful people are working in this industry. So it helps.
Yeah. With you as a CEO founder of Knopka, it's like Knopka has not only their branding, pink and everything, but their own face with you, and everyone hope in like by the end of the year, every hospital in Ukraine will have the contact of you, like Ivan Knopka, in their phone book.
I really want and hope that we do something right, which will be evaluated by hospital director as something good for their facility. Yeah. And I really want this, but if the hospital or hospital director is not ready, we respect this, and we will wait for their answer. Yes, we can wait a little bit. Patients can
wait.
We can wait
24 hours, maybe.
Together, we will cover nice, sharp storytelling that will touch even that hearts who are not ready to onboard our solution right now.
Yeah.
This is our approach.
Yeah, I love it. Yeah. And right now you became unfrozen. Yeah. Well, huge thanks for everybody who listened to us, who were watching us. Thanks to Ksenia. As always, he's coming to these streams to say words of appreciation. We love you too. Thank everybody for listening, watching, whatever. Bye-bye.
Bye.